What's frustrating about heart disease is how symptoms like shortness of breath and fatigue are often explained away as just common signs of aging. But thousands of Americans have severe aortic heart valve disease. Here to discuss an important clinical breakthrough in heart valve medicine, Dr. John Puskas. Good morning.
Good morning, Mary.
Let's start with aortic heart valve disease. What is it, and then how is it treated?
Mary, the aortic valve functions to open and allow blood to exit the heart to go to the whole body, and then to close between heartbeats to prevent the blood from falling back into the heart. The leaflets of the valve may become thickened and calcified and stiff, and that prevents them from opening properly or closing properly. And that's aortic valve disease. When that occurs, the patient's heart has to work extra hard, and the patient becomes short of breath and fatigued and may even develop chest pain.
So this point about treatment, what do you recommend?
As the valve symptoms worsen, surgical replacement becomes appropriate. The patient must then choose between having a tissue valve, which is derived from a cow or pig heart, or a mechanical valve, which is man-made. The tissue valves are convenient because they don't require a blood thinner, but they have a limited lifespan. They typically last 10 to 15 years and then require another replacement. Mechanical valves, on the other hand, are designed to last a lifetime, but they do require a daily medication called an anticoagulant or blood thinner.
And this recent announcement regarding the FDA's position on blood thinning medications, what was it?
As a result of a nationwide clinical trial that I had the privilege of leading, the FDA recently ruled that patients who have the Onyx valve implanted in the aortic position can take lower doses of blood thinner than other mechanical valves. And this is associated with fewer bleeding episodes and still no more strokes. So this is a big breakthrough for patients who need an aortic valve replacement. They can choose to have an Onyx mechanical valve, which will be a lifelong solution, and still have very, very low risk of bleeding problems. So this is a better quality of life.
Huge news for patients. So as they're listening to our conversation now, maybe preparing for their next visit to see their doctor, which questions would you recommend they ask?
Patients should discuss with their physicians the progression of symptoms and the timing of surgery, the valve choice, and then whether the Onyx valve might be appropriate for them. They can also seek more information at the Onyx website, which is onxlti.com.
What are you hearing right now from patients? I know all of this is still very new. What's the early feedback?
Patients are excited to be able to avoid a reoperation with a tissue valve and to have the benefit of lower doses of blood thinner with a mechanical valve.
You mentioned
this is, in a sense, having your cake and eating it too.
And you mentioned the stroke potential lessening as well. So does this speak to quality of life ultimately for patients?
Absolutely. You know, we surgeons operate to improve quality of life or length of life. This operation with an aortic valve replacement can accomplish both those things.
It's so impressive, and I got to tell you, I've got a long history of heart disease in my family, so anytime there are breakthroughs concerning the heart, I'm always intrigued. Dr. Puskas, before we let you go, would you give us that website one more time so our viewers can follow up online?
onxlti.com.
onxlti.com. Thanks for joining us today, Doctor. We appreciate your time.
It's my pleasure. Thank you for having me.
Thank you. Mike.
All right, thank you, Mary.